My name is Dorothy Walker. I used to be Dorothy Pierce when I worked here. I graduated in June 1945, and I came here in November 1945, just when they were opening up the second time. Well, it was closed down because of the war.
What was in this building during the war?
The Air Force. And when we came, we were supposed to be go in residence to live, but the Air Force was still in the residence. So they were moving out, so we were billeted up in what was male infirmary, I don't know what it is now, for a few days. They brought these patients the next day, which we didn't expect till the day after, and it was total confusion. But anyway, we put them on a ward. The beds were up, but they weren't made. And fortunately, when they brought this load of patients, they brought 2 registered nurses with them that were accustomed to organizing things, and they sort of got things in hand and helped. They were, well, they ended up in charge, sort of. So we got through it, but the only thing was we had to teach new staff. They weren't experienced, a lot of them. We had to teach them to make beds, how to dress the patients properly, and how to feed them, and because some had to be spoon-fed. So it was a lot of work. A lot of these people were on medication, and the pharmacy wasn't open yet. It was getting going, but it wasn't open, and we couldn't get any drugs. So we had a doctor suite, and he made a list of medications we would need, and he went into Wimbush's drugstore and got a whole bunch of medications to tide us over till the pharmacy opened. And then when the pharmacy opened, all the wards were stocked with standard drugs that patients would need. That was in 1945. We still had Christmas, so they made a special Christmas for the patients, and everybody got a gift, and they were busy making decorations and painting windows. The staff were all pleasant, and it was just like a great big family. After I was here for a little while, they made me supervisor. That would be 46, wouldn't it? Yeah. I think it was 46 I became supervisor. And the patients all went to there was a doctor's dining room, a nurse's dining room, and a dining room for the other staff. And the patients had their own dining room. They had male side and the female side. So, but every patient had to be counted in and out when they went. So you're counting patients out, and then they had to be counted in. And I think some of the, from the dining room, I think some of the silverware, especially the knives, had to be counted after they left to make sure nobody had taken any.